A 45-year-old female presented with a 2-day history of positional dizzy spells and vomiting. This is her right Dix-Hallpike test. There is a severe upbeating and right torsional nystagmus with a latency of 3 seconds and lasting for 23 seconds. On getting up, there is a subtle downbeating and left torsional nystagmus. This is the reversal nystagmus. This was a simple case of right posterior canal periampullary canalithiasis or right typical posterior canal BPPV. And this patient was treated with Epley's maneuver, but post-Epley she developed persistent vertigo on getting up and had difficulty in sitting upright. This is her bow and lean test. So firstly, in the neutral head position, there is a prominent left beating nystagmus. On making the head lean backwards, there is persistence of the left beating nystagmus. On making the head bow forwards, again the left beating nystagmus persists. Now let us check the supine roll test. On making the patient lie down supine, there is prominent left beating nystagmus. On turning the head towards the right side, there is a subtle left beating nystagmus. On turning the head towards the left side, the left beating nystagmus prominently increases. Thus, the presence of a persistent left beating nystagmus and supine roll test showing a persistent left beating nystagmus which increases in intensity on left head roll and decreases in intensity on right head roll is suggestive of the migration of otoliths during Epley's maneuver from the posterior canal to the horizontal canal and causing a partial canal jam. Now ideally a canal jam should be treated with either a head shaking maneuver or a mastoid oscillator. But however, in her case, a single sudden forceful head roll towards the right side was able to dislodge the otoliths and clear the partial canal jam. Let us see the sudden forceful right head roll. So there are a few initial left beating jerks, immediately followed by a severe geotropic horizontal nystagmus. This forceful head roll released the canal jam and subsequently she had a geotropic horizontal nystagmus which was more severe on right head roll as compared to the left head roll. Thus the canal jam was resolved and a right horizontal canalithiasis developed which was geotropic and non-ampullary in location. So the patient was treated with Gufoni maneuver on the right side. And this is her right Dix-Hallpike test post maneuver. As you can see, there is no nystagmus. And the supine roll test. No persistent nystagmus. No nystagmus on right head roll. And neither in the left head roll. Thus, in patients with classical BPPV, often while applying maneuvers, the patient develops canal switch and canal jam, and appropriate maneuvers have to be used to resolve them.